This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. Hi there, this is Professor Michael Chapman. I'm one of the most senior fertility specialists in Australia. I work at Life Fertility Clinic Sydney, and I do consultations around the world. Tomorrow I've actually got a lady in Florida who listens to this program, this podcast, and she is asking me some questions. So tonight I thought we would talk about poor fertilization. So let's just go through that from the start. So when an egg and a sperm are put together in the laboratory, every mature egg that a woman produces has something in the order of 60 to 70% chance of fertilization. In other words, a sperm entering the egg and create the right number of chromosomes to potentially grow onto a baby. That happens within hours of insemination with the sperm. Although the first time we know about that is the following morning, 18 hours later. So if the rate is 60 to 70%, it means that if you got 10 eggs, I would expect the next morning the scientist to be telling you that 7 out of the 10 had actually fertilized. And that's a good fertilization rate. That's a standard fertilization rate. What we call a poor fertilization rate would be when the next morning perhaps there's only 1 or 2 or maybe even no fertilization. The first thing we think about in that situation is, was there a problem in the laboratory? Was there a problem with the culture medium or the temperature? Was everything working? Was the temperature overnight in the incubator correct? So the whole pile of questions that we ask each other in the laboratory when that happens, when we get poor fertilization. Obviously, the best test of that from a laboratory perspective is to look at other women who had eggs collected that day, and if all their fertilization rates are 60 to 70%, obviously the focus moves off the laboratory and on to, is there a problem either with the sperm or with the eggs? Where do we go from there? Well, in relation to eggs, the commonest reason for poor fertilization, sadly, is the age of the woman. So a woman who is, let's say, 43 years of age, her fertilization rate, instead of being 60 to 70%, we would expect to be around 40 to 50%, because already egg quality is starting to show its problems. Beyond that, there are women who do have abnormal eggs. What does that mean? What is an abnormal egg? Well, mostly from a fertilization point of view, it's that the egg has a disorder of the number of chromosomes that it has within it. What it should have is 23 chromosomes at the time of fertilization. So they meet up with the 23 chromosomes from the partner's sperm, and they should get together. But if you start off with 22 chromosomes or maybe 24 chromosomes, then that embryo or that egg is less likely to fertilize. Can we tell that? Well, we can't tell it easily. What we do have is a couple of things. One is, first of all, just looking at the egg down the microscope. If it's got a dark texture to it, then we're obviously a little suspicious there's something not right. And normally they're clear down the light microscope. What we have in our laboratory at Life Fertility Sydney is something called polarized light microscopy. And certainly whenever I have poor fertilization in a patient, the next cycle, we will actually look at every egg with polarized light microscopy, and what that does is show us inside the egg a number of the structures that are vital to normal fertilization. Just before fertilization happens, when an egg is mature, the chromosomes, the 23 chromosomes, should be lining up in the shape of a spindle. And then the polarized light can actually look at those and look at the spindle and see whether it's normal or not. We know if we've got a normal spindle that the fertilization rate will be much higher, and in fact the formation of a day 5 embryo will occur in about 60% of those with those eggs. If, however, you have a spindle that is maybe not there at all at the right time, or if it's there, it's Raggedy Ann, then we know that the blastocyst rate is as low as 4%. So there's a huge difference after we've looked at the eggs. That doesn't help you really in terms of getting a pregnancy, but what it does do is help us say this is a good egg and you're producing good eggs, and we've got to look somewhere else for the reason for poor fertilization. The other, obviously, fertilization is about boys and girls. It's about eggs and sperm. So when men have poor sperm quality, there is an increased risk of low fertilization rates. This in the past, quite a past now, meant that when we put sperm of low numbers with low quality with eggs in a normal IVF situation, we often got failed fertilization. Today, in that situation, we use the sperm injection technique where we take one sperm and inject it into the one egg. And what that does is it doesn't guarantee fertilization. It still takes you back to the 60 to 70%, but it really is a massive improvement with poor sperm quality. So we normally do that anyway. And certainly if you had a normal sperm count and poor fertilization in one cycle, the following cycle we probably would do ICSI anyway, just in case it was a sperm problem that we haven't picked up. There's one group of sperm where we know fertilization rates are lower and the production of an embryo is lower, and those are sperm where there is a high level of something called DNA fragmentation in the head of the sperm. So in that little tadpole that the sperm is, in that all the genetic material, the 23 chromosomes, are all are wrapped up in that tiny little head of sperm. Under the what's called oxidative stress, and that can be drugs, it can be lifestyle, it can be a whole pile of things. In that scenario, the situation is that the sperm won't fertilize an egg properly. So that's the other thing we go looking for in a poor fertilization cycle. But poor fertilization in one cycle doesn't mean you should give up. There are those things that I've just described just to hopefully improve the situation. We'll look at in the DNA fragmentation, for instance, we can use antioxidants, and that seems to improve the fertilization rates. In relation to egg quality, well, there's 100 different things. Unfortunately, none of them are proven, but we do try, and there are some things that I would be doing to try and improve egg quality for the next cycle. And maybe it is that we need to think about when the trigger injection was given. Normally it's 36 hours, but maybe waiting to 38 hours gets us better eggs, albeit there's a risk of ovulating too soon. So there's all those things to take into account when you have poor fertilization. Rarely it is the laboratory. In my experience, almost always it relates to the egg quality or the sperm quality as the underlying reason.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.